Lyme Disease Awareness Month starts tomorrow, and if you're planning on spending more time outside this spring, you're going to want to make sure you're preventing tick bites. 2 on your side's Kelly Dudzik is in studio right now with an important message from the group Lyme Western New York. Kelly, tell us more.
Well, Claudine, the CDC says emergency room visits for tick bites are higher than what they normally are in many parts of the country right now, including the Northeast. And the woman who started Lyme Western New York says tick season is now pretty bad here every year.
Ticks are everywhere.
From the playground to the soccer complex to your backyard, Lyme Western New York's Rebecca Roll says ticks don't care whether you're in the city or the country.
Ticks don't know borders. They don't know that they've left the woods. They don't know that they've, hopped onto a rodent and now they're in an urban setting. It's everywhere.
And that means you need to stay vigilant by checking yourself and your loved ones for ticks, because tick bites can cause Lyme disease.
A tick can be the size of a period at the end of a sentence. So it's a lot of times people don't see them. So really do a thorough tick check every single time after coming indoors. Make sure that you're using preventative sprays on your skin. We typically recommend a product called Sawyer that has picaridin or permethrin on your gear.
Roll says that while some people with Lyme disease will develop a bullseye rash, many will not. And it's important to advocate for yourself to get the medical care you need.
Make sure you get a long enough term of medication.
On May 31st, Lyme Western New York will be holding its annual 5K and fundraiser at Wayland Brewery.
We are a completely nonprofit organization. We are all volunteers, and every single penny that we make from this event goes right back to our organization and goes right back to the Buffalo community and those afflicted by Lyme and tick-borne illnesses.
Lyme Western New York also has monthly support meetings. Next month is on May 13th at the East Seneca Fire Hall. You can find more resources with my story online. On your side, Kelly Dudzik, Channel 2 News.
Kelly, thank you. About 8% of Americans are living with an autoimmune disease, and while there's no cure for many of these conditions, that could be changing. We told you last week about a study at Roswell Park testing a cancer treatment called CAR T-cell therapy. Doctors say early results have already been promising.
Patients with severe lupus and lupus nephritis, scleroderma, even other neurologic conditions such as MS and stiff person syndrome. Patients who have undergone this treatment have experienced significant improvement in their symptoms, if not reversal. This would be an immune reset, really disrupt the autoimmune process that's set up in the tissue, and that the hope is that people will not need treatments long term.
We have more information on this clinical trial over on our website right now, WGRZ.com. April is National Donate Life Month, and today in Niagara Falls, a ceremony honored organ and tissue donors. Niagara Falls Memorial Medical Center partnered with Connect Life for a flag raising recognizing the life-saving impact of donation. Recipients also shared stories, including one man who received a life-saving transplant from his father after being diagnosed with kidney disease.
You might think any parent would, but that's not always the case. Number one, they not always can, or more importantly, are able to. I am so blessed I had a father that not only was a match, but took care of his body and himself in his young years, followed into his adulthood to be able to give his son life for the second time. Ironic seeing that.
Unfortunately, Cameron's first kidney transplant failed, putting him back on the wait list. But last year, everything changed. A Southern Tier family in a similar situation saw his story. When the husband wasn't a match for his own wife, he made a remarkable decision to donate his kidney to Cameron instead, giving him a second chance at life.